Welcome to the 2018 Open Enrollment for Mobile Marketing Solutions. Please note that the following slides were designed to provide you with a brief overview of your 2018 benefit package. In the event of a conflict between the carrier summary and this description, the terms of the carrier summary will prevail. In this presentation, we will review the following: benefit basics, medical benefits, HSA bank, dental insurance, vision insurance, employer-paid life, employer-paid short-term disability, employer-paid long-term disability, voluntary life, voluntary cancer, and voluntary critical illness. You and your eligible family members may apply for benefits if you work at least 30 hours per week. Your benefits are effective on the first of the month following 60 days of full-time employment with Mobile Marketing Solutions, Bruco Marketing Group. Coverage is also available for your spouse and your dependent children. Please check each type of benefit plan for dependent age eligibility rules. You and your eligible dependents must be enrolled within 30 days of becoming eligible. Your elections for the plan year will remain in effect for the full year unless you experience a qualifying life event. If you experience a qualifying life event as listed below, you may change or cancel your coverage during the plan year to meet your needs. You must notify the Human Resource Department within 30 days of the event date to ensure that there is no disruption of coverage. Examples of qualifying events include birth, adoption, and legal guardianship, divorce or legal separation, marriage, death of policyholder, turning age 26 and aging off a parent's plan, loss of Medicaid, FMLA-related leave, loss of employer-sponsored group coverage. For a complete list of qualifying events, please contact your Human Resource Department. Medical benefits. Your medical benefits are provided through Anthem Blue Cross Blue Shield. You have a triple option medical plan in which to choose from. The first column is the core plan. This is a high deductible health plan that can be tied to an HSA bank account. With a high deductible health plan, please note that all co-pays apply after the deductible has been met. With the core plan, you have a $3,000 annual deductible. Again, once you satisfy your deductible, the co-pays will apply. Your total exposure, if you had a really bad year on the core plan, is $4,000. It's also known as your out-of-pocket limit. If you had a really bad year, the max that you would pay out of your pocket is $4,000 for the remainder of that plan year before the carrier will pick up at 100%. The middle plan and the buy-up plan are both PPO plans. What this means is that you have first dollar copays. You do not have to meet your deductible before the copays apply. The middle plan is a $4,000 annual deductible. It has a $35.70 physician specialist copay, a $75 urgent care copay. You have a prescription drug, Tier 1, $10, Tier 2, $35, Tier 3, $75 copay. All of these copays, again, are immediate. Your deductible will come into play when you're hospitalized, when you have lab testing, when you have certain x-rays, etc. All of that goes towards your $4,000 deductible. In the worst case situation, your out-of-pocket limit is $6,600. So again, in comparing with the core plan has the richest out-of-pocket limit, the least exposure on you. With the middle plan, your total out-of-pocket is $6,600. That's, again, the maximum you would be out before the carrier paid at 100% for the remainder of that plan year. Lastly, you have a buy-up plan. This is the richest plan of all, but it's going to cost you the most. The buy-up plan is $1,500 deductible. It has a $20.50 primary care specialty care copay, $75 urgent care copay, and again a $10.35.75 prescription drug copay, all first dollar copays. Again, if you're hospitalized, you have lab testing, additional services, all of those will go towards your deductible. In the worst case scenario, your total out-of-pocket limit, your total exposure on this particular plan is $5,200 before the carrier will pay at 100% for the remainder of the plan year. One thing I do want to review with you is prescription drugs. As you can see by the chart, you have a Tier 1, Tier 2, Tier 3, and Tier 4. Tiers 1, Tier 2, and Tier 3 are immediate copays. That's if you have a generic, if you have a preferred formulary brand, or a non-preferred prescription filled. Tier 4 is specialty drugs. These are the medications that flash across your TV screen that the pharmaceutical companies and the pharmaceutical reps are going into the doctor's offices and promoting. They haven't had a chance to hit a Tier 1, Tier 2, Tier 3 level because most often they've not been out on the marketplace for that long. So these are the drugs that that the doctor has heard the sales approach on. Take this, go get your pharmacy to give this to you. But what happens is you're paying 25% of that drug up to $350 max per prescription. That's a lot of money. And what we're finding in today's day and time is that typically, not always, but typically you can ask for a generic equivalent, and with the combination of taking maybe 2 to 3 different drugs, you might get the same ingredients that's made in that specialty drug. And what it's going to do, it's going to save you money compared to paying that 25%. So I'm not saying 100% of time that's going to work for you because of the particular drug, but there are 90% of the time it does. So just remind your physician when you're at the provider's office to say, is there a generic equivalent available? And let them write that out for you to take to the pharmacy. All of these benefits on this grid are in network. If you went out of network, you would have a separate out-of-network deductible, which is much higher. Oftentimes your copays do not apply. So we want to discourage you from ever going out of network. You do need to make sure that your provider, your hospital, everyone participates in network at the Anthem provider list by visiting www.anthem.com so that those providers who do not participate do not balance bill you. So check your network for medical, dental, and vision providers. Preventative care. Your preventative care is covered at 100% in network on all 3 plans. Immunizations, well woman checkups, well child checkups, mammograms, blood pressure tests, cholesterol tests, and certain tobacco cessation products are all covered at 100%. Now this is provided that your provider files that claim as a wellness claim. But what we hear often is that if you have let's say you have a scanning preventative care visit and you go visit your provider, and while you're in there, you start talking about a cough that you've been having, or you want them to look in your ear because you've had an earache, or you've got a back injury. Can you take a look at that too while I'm here? Well, oftentimes when the provider is looking at something that's deemed sickness, they're going to turn that around and not always file that as an in-network preventative care claim. It could hit your copays and your deductibles. So a suggestion would be is while you go to have your preventative care, limit it to a preventative care visit. And in that way, it's processed correctly. Things to know about your medical plan. The high deductible health plan, also known as the core plan. When you enroll in the high deductible health plan, you are eligible to make contributions into an HSA bank account. This account is set up in your own name. There are no use it or lose it rules, and all unused balances roll over from year to year. We will discuss more about the HSA bank account on the following slides. Mobile Marketing provides an employer contribution of $300 per month towards your medical plans. If you enroll in the core high deductible health plan, it pays your entire single premium. Then the remaining balance of $1.66 per month will be invested in your own HSA bank account. All co-payments, again, office visit, urgent care, prescription drugs, emergency room, apply after the annual deductible is met. Now, in the worst case scenario, if a person had a really bad year, the high deductible health plan has the overall lowest out-of-pocket exposure than either of the PPO plans. The PPO plans, which are the middle and the buy-up plans, they offer you first dollar co-payments. Those co-payments do not apply towards your annual deductible, but they do apply towards that annual out-of-pocket limit. Now, both plans, dependent children are eligible for coverage through age 26, regardless of full-time studentship or marital status. You can save money by utilizing the Anthem mail order program for your maintenance drugs. You can get a 90-day supply through the mail, have them shipped right to your door versus going to the pharmacy for 3 months and paying the typical copay. Emergency room usage. There is a clause in every plan document called the Prudent Person Lay Law, and that's where the carriers have the right to deny non-emergent use of the emergency room. We are seeing carriers enforce this rule. We have been seeing that since late last year. So what's happening, because it's in your plan document, they have the right to do so. So if you go to the emergency room for anything that's not emergent, life, limb-threatening, etc., the carrier has the right to deny that claim. Well, what happens then? You have the right to appeal, but I have to be honest, most appeals that I have seen have been declined as well. So where does that leave you? That leaves you with a huge emergency room bill. We're going to go over some tools that will help you stay away from the emergency room if it's not truly emergent. We obviously want you to go to the emergency care if it is emergent. Do not hesitate. But if it's something just that because your doctor's office is closed, urgent care is closed, it's Sunday night, what do? I will provide you with some additional tools that will help you hopefully stay away from the emergency room when it's truly not an emergent situation. Medical pricing. Medical pricing on this chart is for the benefits that become effective October 1st, 2018. The payroll deductions are for the high deductible core plan, single coverage. Of course, you remember mobile marketing contributes $300 a month across the board. That pays for your high deductible core plan premium, and with the difference, you get $1.66 invested into an HSA bank account. So you can enroll in that plan at no cost to you. If you wish to enroll your spouse, dependent children, then there's the pricing below, and again, this is per payroll deduction. The middle plan is a $4,000 PPO plan. It's costing you $43.19 per paycheck for single coverage, and there's the pricing for the additional dependent coverage. And the buy it plan, again, that's the richest plan. That's a $1,500 deductible, costs you $75.43 per paycheck. $368.50 for employee, spouse, dependent children is listed as well. Now, if you're new to the high deductible health plan concept, let me kind of visit that for a moment. You will get all kinds of tax advantages by utilizing an HSA bank account. So if you are in that plan, I encourage you to put more money into that account to maximize the savings for you. If it's new to you and you don't know where to start, you can contribute as little as $10 a paycheck should you wish to do so. You can max it out. If you're like, well, I don't know what a good starting point is, look at this picture here. If you would enroll today in the $1,500 deductible, you would have to pay $75.43 every paycheck. But you'd be throwing money out the window if you're a person that rarely goes to the doctor and it's not on high-cost medications. So you're not getting a return. The carrier's keeping that money. They're never going to send you a refund check. So what you could do is you could basically invest that $75.43 into your own account that's in your name that will roll over every year if it's unused, $75.43 per paycheck, and as that money is deposited on your HSA bank account, you can use it for medical, dental, vision expenses. If you don't want to use $75.43, you might try $43.19, but again, it could be any number. You could put $10 just to get your feet wet with it, but your greatest potential, obviously, the more money you put into it, then the more is going to be available for your access. What is an HSA account? It is a health savings account. It's a tax advantage account that can be used to pay for your current and future healthcare expenses. Now, when it has to be combined with a high deductible health plan. It cannot be combined with the PPO plan. They're owned by you. It's not like a flexible spending account because these funds roll over year after year if not spent, and they have the ability to earn a tax-free interest. They may be used to pay for qualified expenses such as deductibles, co-pay, co-insurances, prescription drugs, dental, vision, long-term care, nursing home, at any time without a federal tax liability. Now recall, if you enroll in the high deductible health plan, mobile marketing will contribute $1.66 per month into your HSA bank account that's going to be set up through BB&T. Who is eligible for an HSA account? Well, any individual that's enrolled in a high deductible health plan, again, not the PPO. So anyone who's not covered by another health insurance, including a medical flexible spending account, who's not enrolled in Medicare, and who cannot be claimed as a dependent on someone else's tax return. Are my HSA contributions 100% tax deductible from my gross income? Yes, they are. Can I be enrolled in a PPO plan and have an HSA bank account? No, you must be enrolled in the high deductible health plan. If I don't use the funds in my HSA, do I lose them? No, they roll over year after year. Let's say, for instance, you enroll in the high deductible health plan this year and you have $2,000 at next renewal time in your HSA bank account that's not used. And you decide you want to enroll in a PPO plan at next open enrollment. That's fine. That $2,000 that's in your account is still yours. You can still use it, but you cannot make a further contribution into that account until you re-enroll into another high deductible health plan. What is the maximum contribution I can make into my HSA for 2018? It's $3,450 for single and $6,900 for family. However, if you're 55 and older, you have an additional catch-up contribution of $1,000 that you can contribute. Now, note that these limits also include the employer-paid portion. So if you're intending on maxing it out by putting in $3,450, it minus out the amount that the employer is putting in. How do I enroll? You will automatically have an HSA bank account set up for you when you enroll in the high deductible health plan. Now, if you wish to contribute towards your HSA bank account, you'll just need to elect that when you go into the Benesolv enrollment system. Sample of HSA qualified expenses. Samples include acupuncture, which is not covered on your medical plan, ambulance, artificial teeth, doctor's office visits, drug addiction. I know that I use my HSA card. I scan it at certain health stores so I can get my protein drinks and so forth. Not all are qualified, but you can certainly try it because the card that is in is like a debit card. It comes in your name, and you can use it for qualified expenses. But if you try to swipe it for something that's not qualified, it will reject it. So on here it states that you can use it for wheelchairs, long-term care services limited, insulin. There are many, many things on this list, and it's not a complete list, so you can certainly request a complete list from your Human Resource Department. Anthem value-added services. Okay, as we spoke earlier, the emergency room, we're seeing a lot of those claims denied because of non-emergent situations. Well, what we've got for you is that you've got live health through Anthem available to you 24 hours a day, 7 days a week, 365 days a year. And it's available to you anywhere you have a computer or a mobile device, because you Skype. You Skype with a board-certified doctor. That doctor has to see you and you have to see them. So what you do is you have a panel of board-certified doctors, so you can choose if you want to talk to a male doctor or a female doctor. And what's so wonderful about this is that they're able to treat you and send a prescription to your local pharmacy, and usually you're done within 10 to 15 minutes. If you're enrolled in a PPO plan, you pay your normal copay at the time of the call. You give them your debit card number or your HSA card number or your MasterCard number, and you pay for it at the time of service. If you're enrolled in the high deductible core plan, then you'll pay $49 at the time of the call. So you, again, will pay there. What's also really good is that if you're enrolled as single coverage into Anthem now, but your spouse and dependent children may be covered elsewhere, they too can use this service. So it's a $49 charge at the time of the call. So again, what the service is, it's available to you because who wants to go to urgent care, and nothing about urgent care is urgent. And you go into an environment where there are other sick people, and you may leave within an hour, and you're going to leave with a very hefty bill. I can guarantee it's not going to be, just $49 on a high deductible health plan. So I want to encourage you to use this because it's available to you on those weekends and those nights when you can't reach other sources. Live Health Online Doctors consults with patients on things such as commonly seen conditions such as fever, sore throat, cough, cold, flu, urinary tract infection, allergies, skin disorders, heartburns, This is a treatment that they can help. You know, you can Skype if you have a sore throat. The doctor will ask you to open your mouth. Then he looks in your mouth, and boom, he can write a prescription. You go pick it up at your local pharmacy, and you are done. It's just really, really quick, saves you money, and it keeps you out of those environments. You don't miss work. It's really, really easy. They also have Live Health Online Psychology, which is great because who doesn't have stress anymore? You can get help for stress, anxiety, depression, family relationship issues, grief, panic attacks. You get also board certified providers with 15 years or more in practicing medicine, and you can speak with these providers because otherwise, you know, what do? You call someone local, and it's a 3-month wait before you can get on their list, and you have to take off work. And you know, this is simple, this is easy. Now, what I do want to encourage you to do is pre-register for Live Health once your coverage becomes effective 10/1, because it's a very simple process. But if you're burning up with a fever, the last thing you want to do is to say, okay, here's my name, here's my social, here's my date. Go ahead and register, because once you're already registered, it's a breeze. You sign up, you choose a doctor, and then you begin your consultation. 24/7 nurse line. Anthem has always had a 24/7 nurse line. It's wonderful for you because it could help you in situations where, you know, you may be traveling, and, you know, let's say your baby has a fever and you don't know what to do. You know, they're tugging at your ear. What should I do? They're going to make recommendations. Now, the difference with the nurse line is free. There's no charge for that, and you can talk to a nurse 24/7. They cannot prescribe medication, so that's where you need to determine whether or not you need to speak with a nurse that can assist you, because the nurse may just say, hey, you need to go talk to your local provider the next morning. They're going to give you some type of insight, but they can certainly answer questions for you. Now, if it's something a little deeper, such as some of the things that we talked about, the allergies, the flus, all that, and the doctor might have to prescribe a medication or, you know, look in your throat, Skype with you, then certainly it's the Live Health Online that we want to promote. You have choices. There's also a tool called Estimate Your Cost tool on the Anthem web portal, and this is just really great because what happens is once we enroll you within a 10/1 or later effective date, you can go into the system and you can put in the procedure that you're going to have done, and it's going to pull up your particular plan, and based on your deductible and your copay, it's going to give you a projection as to how much you're going to pay to have a procedure done. It will also give you competitive pricing between different providers in the area so that you know, hey, you know, that provider charges a lot. I think I'm going to go a little bit over this way and have this provider to treat me instead because it costs me less money. So those are the tools that I wanted to make you aware of that's out there that cost you nothing. Once you're enrolled into the system after 10/1, you will be able to go in and access and even pull your explanation of benefits. Very easy. Dental insurance. Dental insurance is through Anthem Blue Cross Blue Shield. You have a 0 deductible. All preventative and diagnostic services are covered at 100%. The basic and major services are all covered at 50%. Your annual maximum per insured person is $1,200, and you also have a lifetime ortho benefit for dependent children of $1,200. That's a lifetime benefit on the ortho. The deductions for single enrollment is $12.40. You can enroll your spouse or child, one dependent, at $28.41 per paycheck, or family at $46.49. Again, remember, dependent children are covered through age 26, and always check to make sure that your provider participates in the Anthem network. Vision benefits. The vision benefits also are through Anthem Blue Cross Blue Shield. You have a $10 copay for eye exams. You have a $25 copay for lenses and additional copays for lens enhancements. You have a $130 allowance for eyeglass frames with 20% off remaining balance, and $130 allowance with 15% off the balance for lenses. So you are able to have an eye exam once every 12 months, so it's 12 months from your last visit, and you also get new lenses every 12 months, and then you'll have frames every 24 months. The cost for this per payroll deduction is $3.71. You can add your spouse, your dependent children. Again, dependent children can be covered through age 26 regardless of full-time studentship or marital status. Please make sure that your provider participates in the Anthem network by visiting www.anthem.com. Life and disability. Mobile Marketing Solutions provides full-time employees with $25,000 employer-paid life and accidental death insurance. This employer is 100% paid by the company, so there's no additional cost to the employee. There is an age reduction schedule that starts at age 65 and further reduces at age 70, and all coverage will terminate at retirement. Mobile Marketing Solutions provides full-time employees with short-term disability that's also employer paid. Short-term disability pays you an income when you cannot work due to a covered accident, including maternity or an off-the-job accident. This benefit is paid by the company, so there's no additional cost to the employee. Benefits begin on day 1 for injury, day 8 for sickness. It's 60% of pre-disability earnings is the payout. It's to a maximum weekly benefit of $1,500, and the benefit duration is 13 weeks. So basically, that's the maximum. If the doctor says, okay, you're going to have to miss work for 7 weeks, then you'll only have a 7-week payout. It's all dictated by the doctor's notes. Long-term disability. Mobile Marketing Solutions provides full-time employees with employer-paid long-term disability insurance. The long-term disability insurance pays you an income when you cannot work due to covered sickness or injury after the short-term disability benefit expires. It's paid in full by the company, so there's no cost to you. The waiting period, the elimination period is 90 days, so again, it piggybacks with the short-term disability. It pays up to 60% of your pre-disability earnings to a monthly max of $6,000. The duration is greater of 36 months up to Social Security retirement age before age 65. Members through age 65, 67 is 24 months, 68 to 69 is 18, 70 to 71 is 15, and age 72 and over is 12 months. Voluntary life and accidental death. As a full-time employee of Mobile Marketing Solutions, you're eligible to elect voluntary life through One America. The benefit overview is as follows. Employees. You can receive up to 5 times your annual base salary, $300,000 maximum, if you're first eligible as a new hire applying for this benefit. The guarantee issue for new hires under age 70 is $100,000. Spouses can apply up to 50% of your benefit, up to $150,000 max. The guarantee issued during your new hire event is $25,000. Coverage for spouses will terminate at age 70. Dependent children, live birth through 6 months is a $1,000 payout, and 6 months to age 26 is a flat $10,000 payout. Age reductions start at age 70. The next reduction will occur at age 75, and then at age 80, all coverage will terminate at retirement. If you currently have a minimum of $10,000 voluntary life, not to exceed the maximum 5 times your annual salary with One America, you may apply during this open enrollment for an additional $10,000 without health questions. It's a great opportunity to increase your voluntary life coverage if you've been diagnosed with critical illness or sickness that would otherwise keep you from being approved for additional life insurance. If, however, you and your spouse previously declined the voluntary term life through One America and are applying for the very first time at this open enrollment, you will have to complete an evidence of insurability form and answer health questions. This will be subject to underwriter approval. Travel Assistance Program. A travel assistance program through Europe Assistance USA is available to members who are enrolled in a voluntary life insurance plan through One America. The travel assistance benefit applies to covered persons who are traveling 100 miles or more away from their home lasting 90 days or less. If you're hospitalized while traveling alone, the EA will arrange and pay a round-trip transportation for a person of your choice to be with you. Additional services include, but are not limited to, medical search and referral, medical monitoring, emergency evacuation, dependent children assistance, replacement of medical and eyeglasses, vehicle return, emergency travel arrangements, emergency cash, locating lost or stolen items, legal assistance bail bond, interpretation, translation, pre-trip information. So there's a lot of benefits that are available to you that sometimes we take for granted when we're traveling. We're worried about getting there, and things happen. So again, this is a benefit that's available to you if you're already enrolled into the voluntary life benefit. Allstate, cancer and critical illness. Allstate cancer policy is a very, very rich product. If you're already enrolled in that product, you do not have to make any changes. You are good to go. If you have not enrolled into this benefit, I want to tell you how this benefit works. You have typical cancer payouts such as chemo, radiation. There's a $10,000 max every 12 months. You have surgery. This is just a snapshot of just a few of the payouts. You have at-home nursing. You have continuous hospital confinement payout, daily rates, and so forth. There are truly cancer payouts that go to you, because I know you've gone into stores, maybe some of the country stores, and you've seen a little jar on the counter with the picture. Those jars do not accumulate enough money to help you pay your bills. Your medical insurance is hopefully keeping the provider at bay, keeping him happy by paying him, but you're still responsible for your deductible. And what about when you travel and then you've not worked and you got extra expenses on top of that? What if this is for your dependent and you want to get the very best treatment that you possibly can, and it's not in this state? What if you have to travel? Well, that's where the cancer policy comes in for you, because it pays the actual charges, the benefit, it pays the benefit to you. Now, on this, built in on top of it, is an ICU benefit. And what that is that if you are air or ground transported by ambulance to an ICU benefit, ICU unit at the hospital with a direct admittance to ICU, it's going to pay your entire bill. Now, what I am seeing in the marketplace is some of these air flight services are charging anywhere to $40,000 to $70,000 is what I am hearing. The medical carrier will not pay that entire bill. You'll get only a fraction of that paid. So what happens? The air evac people come after you. There's really no negotiating with them. And it's forcing people to go into bankruptcy to sell things. We want you to be covered, because with this additional service, if you were to be air evac by any air evacuation service, then, and you have a direct admittance into an ICU unit, it's going to pay that entire bill. All you've got to do is send them the bill. So that way, you don't have to worry if you're a member of your local air evacuation services and you're traveling through Georgia, who has a different one worked out with the state troopers there, because, you know, state troopers going to call the nearest one that they've recently connected with and get you out of there life flighted somewhere. So this one, you don't have to worry about a network. It's going to pay the entire item, the entire billed amount. And there's also an additional 29 dreaded diseases that are covered under this. You do have, if you're enrolling for the first time, a 12-12 look back. So if you have cancer now, then that cancer has a 12-month exclusion, but all new cancer diagnoses are covered on your effective date. The ICU benefit is there on your effective date, plus you have a $100 wellness. As we mentioned on the medical slide, your preventative in-network is paid at 100%. There's $100 per covered person right there in your pocket. It's a great benefit, and it's very affordable. It's at $10.51 for single coverage every paycheck, and of course you can add your dependents through age 26. The critical illness is a lump sum critical illness. This policy covers many things, and their samples are listed below, but cancer is not included. It will give you a lump sum payout if you were diagnosed, upon the diagnosis of a heart attack, stroke, organ failure, renal failure, Alzheimer's, Parkinson's, complete loss of hearing, paralysis, etc. So again, what happens is that upon the diagnosis of a covered critical illness, you send in the information, the claim form to Allstate, and they send you $10,000, because keep in mind, you might have to have home modifications. You will have, obviously, you may miss work. You could have a modified vehicle that you have to get around in. There are certain things that may be involved with you, especially if you have a paralysis. You're going to have life changes. So again, this is paid to you to help you pay your bills. It also has 23 different preventative tests that are covered with a $50 payout. So if you have both policies, it's going to pay you $150 per year for just your wellness visits that's covered at no cost in network on the medical plan. You don't even have to be enrolled in the medical plan to have this. If you're enrolled someone else, you could still be apply for this coverage. If you were to have a heart attack and then had really unfortunate experience and had a stroke, there'd be 2 payouts. And there's additional payouts as long as there's a separation in between the critical illnesses. Sample for this pricing, employee-only pricing includes child coverage, and the 36-year-old uni tobacco on this chart is showing $2.58 per paycheck. This is just an incredible benefit, and don't wait until you're diagnosed, because at that time you could make yourself uninsurable in getting this policy in the future. If you've previously waived either the cancer or critical illness benefit and you're applying for the first time at this open enrollment, you will have to answer health questions by completing an evidence of insurability form. Your applications will be subject to review and acceptance or declination by the all-state underwriting team. Okay, as a reminder, this is your annual open enrollment. You must keep all elected benefits in place until 2019 unless you experience a qualifying event. How do I enroll? We're using the Benesolv enrollment platform. You'll log on, visit their website, you'll register, and then you'll verify your information, and then you'll proceed to enroll into your benefits. Summary of benefits coverage. The SBC is available to you should you need a copy from your Human Resource Department. It's also going to be posted on the enrollment portal. It's just a huge overview of your medical benefit that, again, is available to you, and it's out there for you to obtain should you wish to view on the portal. Thank you very much for attending the 2018 Open Enrollment presentation for Mobile Marketing Solutions. If you should have any questions, please contact your Human Resource Department.